Scam.
Yeah, Anilji, our YouTube live is on, and please welcome Dr. Saab, and we can start that, please.
Okay, Dr. Saab, welcome again. We are live on YouTube, and you can go ahead and start your presentation now.
Okay, good afternoon. Thank you. I am Dr. Vaduganathan. I am affiliated with the Memorial Hermann Southeast Hospital. I'm also clinical assistant professor at Baylor College of Medicine. I thank Arya Samaj leadership for giving this opportunity on to talk on this important topic. Let me start with a small prayer. Vakratunda Mahakaya Surya Kodi Samaprabha Nirvignam Gurume Deva Sarva Karyesu Sarvada. Thank you. Now, my first slide is me. I'm just trying. Okay. So COVID is on top of our mind all over, and this has been one of a kind disease which has affected mankind in the last 100 years. It's not just something which one would see in one's lifetime. It's something which happens in 100 years. So not everybody would go through something like this. And we happen to be the ones who have gone through this. And the last time something like this happened in the 1918, which is 200 years ago, when the flu pandemic first came, the flu. Now, after 100 years, now we have a flu vaccine for that. And many of you are probably taking flu vaccine. Some of you are still reluctant to take that. The flu shots are only effective about 65%. So even if you get a flu shot, you are only going to be protected 2/3 of the time. Well, 1/3 of the time you can still get flu. So that's after 100 years of flu, that's what we have. But now we got COVID started in the beginning of the year in 2020, and now we are in the beginning of year 2021. We have 1 year has gone by. We have vaccines now, which is good news. But the vaccines is going to take a long time before everybody gets the vaccine. And the pandemic will not get over until about 70% of the population either get the disease or get vaccinated. So right now we are far away from that. So it's maybe by June is when about 75% of the US population will get the vaccine. Now we are in end of January. So we have another 5 months to go. So we need to follow still social distancing, mask, hand washing. And so that I'm going to rush through. I mean, all of you are very familiar with all of this, so I won't bore you with anything except I would go through the activities. What are the
That drawing sucks. You got the texture and all right. Look! Hold on. So low risk is when you're opening the mail.
Yeah, so
And die.
So can you hear me? Yes. Let's have question and answers after about 30 minutes. So just hold your questions. You can take a note, and I'll answer all your questions. But let's go through this. Like opening a mail is low risk, but we have in the beginning, a lot of us were very concerned about taking packages and bringing grocery, which is delivered to your door inside. Many were washing everything. So then they found that this packages had actual COVID on them. Amazon deliveries were having COVID on them. But subsequent studies have revealed even if they found COVID on these packages, they were dead virus. So they were not causing disease. So we were going overboard on that. So inanimate things like surfaces, tables, or chairs, you go and wait in a doctor's waiting room, and all of those you sit and guess. So people were very uncomfortable to go, I mean, including myself. So now we know that the spread from those are very, very, very minimal. So COVID spreads from human beings to human beings. So the most important thing is to avoid crowded places, coming in close contact with people without a mask directly and talking to them, or eating in a restaurant. So those are the more high-risk activities. So low-risk activities are the opening the mail, getting to a restaurant, pumping gas, playing tennis. Camping is a good activity. I mean, there's a lot of Texas state parks are available, and it's $10 for a day trip. You have to book it, and there are very nice places, and I have been to 3 of them in the last year, and they are very nice outdoor activity for the day. People are getting so bored watching Netflix all day and TV, but this will be a good outing which is safe. So maybe if you and your family members want to take out and take some food and go to this lakeside and all to this, and then spend the day and come back, let's really and walk around the lake, will be a good thing to do. So then low to moderate is going for grocery shopping. If you know where to go, don't have to spend exactly go. I do self-checkout because I don't want other people, but just come, I mean, just got used to some routine, whatever routine you can. But if you want to get delivered, fine, go for that. Walking in your neighborhood is good, and going to low to moderate. Now we're going in a hotel. Once in a while, you have to go, and staying in a hotel, and it's okay. Just as soon as you go in, you just do some cleaning in the thing, and then the phone, the commonly touched areas. And after that, you tell them no need for room service. And then you just, until you check out the 2 days or 3 days, which you will be very safe. Don't go for the buffet breakfast, but bring the food to your room and eat. Going to library is fine. Eating outside in a restaurant, if you have to eat outside. No eating inside the restaurant. So these are some of the things which you can do. Then you have moderate risk. If you go to somebody's house in the backyard, it is still some risk. If you have 2 or 3 families, you are in the moderate risk category, but definitely not inside the house. Then you're going to a swimming pool, you have moderate risk, 6. So it's now coming, attending an elderly relative or friend in their home is considered in level 6. 7 will be going to the hair salon, or going to a wedding or a public event in a big crowded satsang. All of that is moderate to high risk. So people who are 60, 70 plus, I think should wait on that. So next will be even higher risk is movie theaters and other religious services with 500 people packed. Those are all things which are considered high risk. So I know you are all already adjusted to these things. So I just thought I will mention. Now we will go to the vaccines, because the vaccines is the next thing which all of us have to be familiar with. What about the vaccine? What are the details? I mean, I'm sure there are few people still very skeptical about taking the vaccine. And there are, as I say here, virus vaccines are the live attenuated vaccines or inactivated. Polio vaccine is an example of that. Then vector vaccines and nucleic acid vaccines and protein-based vaccines. The viral vector vaccines is the Oxford AstraZeneca vaccine is the viral vector vaccine, is an example of a viral vector vaccine. And the RNA and DNA vaccines are the nucleic acid vaccines. And we have BioNTech, Pfizer and Modona are the 2 right now on the emergency use authorization by FDA. And they are both are RNA vaccines. So now we go to the next slide. So these are the 4 common ones. And I have to add one from in India. They have added one. So India has Oxford vaccine, and they have one more of a India developed vaccine. But we have these two, the second and third are the US vaccines. The fourth one is the Russian vaccine. I won't talk about it. So we will, the Oxford vaccine, let me just touch on that. It is 60 to 90% effective. Why is it called viral vector vaccines? What they developed was when they, about 10 years ago, when they had other coronaviruses and Zika and other viruses were coming, Oxford invested in getting a dummy non-pathogenic viral vector. So they created something which they can use as a vector to take it to the human beings. And then, so it was already ready to go. So then they injected the genetic material, they modified this vector for coronavirus, and then it is ready to go. That's how they developed it. So it is a viral vector. It does go into your nucleus, which means DNA. So then it makes the body develop antibodies. So it is 60 to 90%. It had two arms in its study. One is a low dose, high dose. The other is too high dose. So they had the bigger arm, which was too high dose. The smaller arm was low dose, high dose. Ironically, the too high dose arm had only about 62% efficacy, whereas the low dose, high dose arm had a 90% efficacy. So that was a little bit of a confusion, because why would a low dose, high dose be more effective than a high dose vaccine? So this needs to be answered. But nevertheless, it's effective. It's as good or better than a flu vaccine. So United Kingdom has authorized it. India has authorized it. And US probably will authorize it as well. And the big advantage is it's very inexpensive. It's only $4. And regular fridge temperature. So this is huge advantage. It can be in many villages in India. So for India, this is perfect. So then the next is the Pfizer-BioNTech is a German-US collaboration. And these two are RNA viruses. So I will talk about the mechanism in more detail. But in this slide, they are both 2 doses. Both are 95% effective. Both are RNA viruses. The most expensive is Modona vaccine, is fully US developed, is about $33, whereas Pfizer is $20. The Pfizer vaccine requires to be transported in -70 degrees, whereas the Modona is -20. -20 is our kitchen refrigerator, freezer. So Modona has a little more easier, whereas Pfizer is a little bit harder. But even then, in reality, we found that, for example, I am with Memorial Hermann. They have this type of freezer in the medical center, their Hermann Memorial Hospital. And they send the vaccines to each of their 9 or 10 acute care hospitals on Monday morning on dry ice. And so they can keep it for the next 5 days in dry ice and administer these doses. So, but they monitor the temperature very carefully, and they are able to maintain it. So it's okay in a city, it's feasible, but in remote villages it is hard, because you have to at least have one big freezer facility from where they can distribute the vaccine. Whereas Modona is a lot easier. Most of you might have gotten by now Modona vaccines if you have had it. Now, next slide. Okay, so comparison of Pfizer and Modona. Both are 95% effective. The Pfizer is 30 microgram dose. It is given 3 weeks apart. So if you got your first dose, you get your second dose in 3 weeks for Pfizer. Whereas Modona is 100 microgram dose, but given 4 weeks apart. It comes in 5-dose vials. Modona comes in 10-dose vials. So that's sometimes you might have noticed if you have gone. I know some of my friends who have done this. They went with the husband and wife went. Husband does the appointment, the wife didn't, and they have asked the people there, can I have the dose? They say, we can't tell you, but if you want to hang around until 4:30, 5 o'clock, we might, if I have, we will give. So if they open some 10-dose vials, they have 1 or 2 doses left in them, they will give it to you at the end of the day. So there is this has happened to 3 of my friends. So if you go a little later in the evening and get an appointment for one of you, the other might be lucky to get the second dose as well. Once you get your dose, they will give you automatically your second dose appointment. Then I told you the degree, the temperatures, and they had 36,000 people in the Pfizer trial, and Modona had 30,000. So we have 75,000 people who had in the study. So it's a robust study. It's not like some 1,000, 2,000 people. So good study, well-conducted study, and the trial data is convincing, and it is 95% effective. So we will go to the next slide. So the messenger RNA technology is not new. It has been discovered 30 years ago, but we never had an opportunity to use it in real life. And SARS and MERS, as you know, coronavirus is also not new. They have several coronaviruses, at least 7 named ones before. SARS and MERS were before, and coronavirus or COVID-19, which is coronavirus disease 2019, is COVID-19, which was originally called coronavirus 2. Now it's renamed as COVID virus or coronavirus disease. So when they developed that, they had some trials for messenger RNA, but they never taken it to the final level until this happened, and everybody raced to do that. So now, what is this little bit more about what is mRNA vaccine? So as you know, in the cell, we have nucleus, cytoplasm. In the cytoplasm, we have this messenger RNA. Whereas inside the nucleus, we have the DNA, deoxyribonucleic acid, whereas messenger ribonucleic acid is the mRNA. So this COVID-19 had the so-called the spike protein. That's why we call the corona, because it's like a crown. Thus, they developed a vaccine based on the spike protein on the surface of the virus. They used that protein, and they developed this vaccine with some adjuvants added to amplify its effect. They inject in their upper arm, and once it's inside the muscle, the cell, what it happens is the protein paste, the cell breaks it down and gets rid of it and makes a new protein piece out of the spike protein we injected. So now this new cell, the muscle cell where we injected, it shows off this new protein it synthesized using the mRNA. And it keeps it on its surface, the new protein which it synthesized. But the beauty is it destroys the piece which we introduced. Whatever we injected in the vaccine, it gets rid of it, and it has now a new protein piece from what it developed from the knowledge it gained from the mRNA. And now this new protein is on the surface of the muscle cells, and the body now sees that a coronavirus has entered it. And so immediately it starts antibodies. And it's called the Igg antibodies. And these antibodies, whenever real coronavirus comes, it fights the COVID and you don't get serious disease. That's the concept or the basis of this vaccine. So the mRNA never enters the nucleus. So some people are worried whether it will alter your DNA. No, it can never do that. So and can you develop COVID by the vaccine? No, because it's only a protein, the spike protein. It's not the real virus itself. So, what are the composition of this vaccine? And then what side effects you can expect? After the first dose, you can get fever. I have had both doses. I have already more than 2 weeks after my second dose. So I had, after the first dose, I had muscle pain. I didn't have any fever, chills or anything. I thought a little bit of headache maybe, and it was there for 2 days, but I went to work next day. And then the second dose, I had a little more headache, and I felt like a little bit kind of, I didn't want to watch even TV, want to be left alone. I did take some Tylenol and one Motrin when I took my second dose. And the next day it was less. And then the following day, I didn't have anything. I did not lose any work day or anything. I went to work both times. And there are other, my colleagues in the hospital who have received, a few of them had a little more serious reaction after the second dose. Nobody was hospitalized. Everybody had recovered and everything, but they had one day they didn't come to work, some of them, because it was a little more pain and they did have fever of 100 degrees, 101. Some of them have developed that, and it is well described. The most important thing is it avoids hospitalization. So, but few people will have more reaction, and it is right now the experience that younger people have more of these symptoms, and the older people have much less symptoms. But everybody gets protected. But the younger people, because they think they are fighting something new, so they develop a robust, it is indicative of an antibody response. All the symptoms after the vaccine actually indicates you are getting the antibody. So that is good. Now, why should you get vaccinated? So the question is, it's a 95% protection, fine, but somebody else may be skeptical and say, well, I'm going to wear my mask, I'm going to social distance, and the disease is under 2%, I mean, right now 2% mortality. And so, 98% I'm going to recover. Why should I have the vaccine? There is a lot of people who recover, they don't recover completely. They have some residual cough. They have some congestion. They have a breathing capacity. If you do lung function tests, they have reduced lung capacities. And even they have cardiac symptoms like tachycardias and even heart failure symptoms. Not common, rare. And there has been some strokes in people who have had COVID, and seizures and Guillain-Barré, and even Parkinson's and Alzheimer's. It is considered is a possibility, because this can affect different systems. So why go through, even if even that is not happening, you can have some of this. So we don't have all the details of what is the percentage of all of this, but we know these things happen. So I'm going to answer some of the common questions. So, and then later we can ask your questions. Can a COVID vaccine make me sick with COVID-1? No. COVID-19, no, it cannot, because we are not injecting live virus, we are injecting the protein. Next, after getting vaccine, will I test positive on a COVID-19 test, PCR test, or even rapid test? No, you will not, because you don't develop, you only have the antibody response, you don't develop COVID disease. If you have already had COVID and recovered, do I need to get vaccinated? They say yes, because right now the general consensus is if you have COVID, the antibody response lasts about 4 months and you can get it again, COVID. And if there's a new variant, it could get. And so I think 3 months after your recovery from COVID-19 disease, you should get vaccinated. And that is the recommendation. Will a COVID vaccine protect me from getting sick with COVID-19? Yes, COVID-19 teaches your immune system to fight the COVID. So even if you get COVID, you won't get admitted. So if 95% of the people don't get COVID and 5% who get it, even them, they don't get admitted to the hospital, that means 100% of the time you won't get, I won't say 100%, almost there, that you won't need to get admitted to a hospital. That's a huge thing. Whether you are a working person or not, getting admitted to a hospital, those of you who have gone through that will know how impact it has on you. So that's a huge thing. So if you don't have to get admitted and you are just to have a disease, even if you get it, you recover in a day or two, that's a huge thing. So I would highly recommend everybody should get vaccinated. Will a COVID vaccine alter my DNA? I already told you it doesn't, because it doesn't even enter your nucleus. There's no way it can alter your DNA. So this is the data published in New England Journal on the Pfizer vaccine. So it has this, they had the data on the 2 arms of people, and this curve is important. So if you see this graph, that the red is the arm where the BioNTech Pfizer vaccine was given. The blue is the placebo arm. And you see after the first dose, there's a lot of people, 50 people got COVID on the Pfizer vaccine group and 275 on the placebo group. So if you get your first dose of your vaccine, don't think immediately you get protected. You are not. So see, this separation happens at day 10. This is day 10. 10 days after your first dose, you have 50% protection. So you are protected 50%, which is something, but not 100%. Then that improves as the days goes by. And 2 weeks after your second dose, you get 95% protected. So you say dose 2 to 7 days after dose 2, you see more than 7 days after dose 2 is 9 people on the Pfizer group and the 172 people on the placebo group. That is what the 95% efficacy comes from, that last line. So their data is good 2 weeks after or 7 days after dose 2. They say for younger folks, 7 days is good. For older people, they say 2 weeks is be more safe. So if you have had your second dose and if you have 2 weeks after that, you are a little more safer. Then Modona vaccine. This was also, the data is similar, and they had 11 cases occurred in the group of the vaccine, but nobody had, 0 was severe, nobody need to be admitted. The efficacy was 94%, similar to the other one. And there were 236 symptomatic COVID at least 14 days after the first shot, whereas 225 cases in the placebo group and only 11 after the vaccine group. So that's 95%. So as of yesterday, 20,000 people have received the doses. Actually, the split of that 17,000 have received at least 1 dose, and 20 million. And 3 million have had both doses. 17 million have had at least 1 dose. And total of the administered doses are 20 million doses. And distributed for 41 million. That means another 21 million has been shipped and waiting to be given. And so the benefit of the vaccine far outweighs getting COVID. So there's no question about that. So some people have asked whether after getting the vaccine, can you, what is your infectivity? Because after getting the vaccine, you develop Igg antibodies. The Igg antibodies protect you from organ damage like the lungs, the brain, the heart. So whereas in the nasal passages, there's a different type of antibodies called IgA antibodies. So you need IgA antibodies if you don't want anything to come in your nasal passage. But this COVID vaccine does not stimulate IgA antibodies. At least that's our understanding right now. So you could potentially have a nasal COVID infection and get a little bit of a runny nose. And then you won't even know, or you may not even know, you may have it in your nasal passages, and you can potentially transmit to somebody else who have not been vaccinated. That is the concern. That is why we still have to wear the mask for the sake of others, even if you are 2 weeks after the vaccination, until we have this herd immunity, which is a 75%. That means around June of this year. So you cannot get rid of this mask and social distancing until roughly about May, June of this year. But there is some data here, which is encouraging. Without going through here, I will just say that even in the limited data we have, they only had this done in Modona vaccine and the AstraZeneca vaccine. The Pfizer did not do that. In asymptomatic people, whether they had the COVID test positive, they tested it and they found it had some 2/3 protection. So it reduced it by 2/3 even in, so that means your infectivity also goes down after the vaccine by about 2/3. But 1/3 of you after vaccination can still spread. So if you have, let's say, 1,000 people in Arya Samaj have been vaccinated, 300 of them can still spread, even though they don't have any disease. They may not get anything, but they could potentially spread it. That's why we all have to wear masks until then. So the 650 may not infect anybody. So they are safer people, but we don't know who is who. So, I mean, this is rough data. We don't know how much, but we know still you can spread it even though you don't get it. So please keep the social distancing and hand washing until we all become safe. So how to register for the vaccine? Probably the most important slide of the whole presentation. So different resources are going to be available. So be on the lookout. Whoever is the point person in Arya Samaj, I know anything I can continue to pass. This is the most common site, the VACS track or vaccination track or VACS track.Harris County, Texas, which is hctx.net. If you want to take a picture of that, but you probably already know. And this is, you can put it like in your bookmark, and you need to check this every day. So about 300,000 doses are going to be available this coming week in Houston alone. So that means they will be, this Harris County, Texas will get the most of it. All the others will get as well, but they are the ones who are going to get bulk of it. So if you click and they say around 5:36, they load, they just open it, and within 30 minutes to an hour, it gets filled. Then they maybe next day or maybe 2 days later, when you get the next thing, they open it. So if you click it now, it will say there is no vaccine available. But if you, when you click and it opens in the morning, don't wait to do anything else. Just immediately put your first name, last name. It will ask you for your date of birth, your cell phone number, your email address, and your mother's maiden name or last name or something like that. But it will not ask you your social security number. So if you get a link from somebody which asks you for social security number, don't put it. Because that will be, I mean, because you have to be aware of other fake sites. So, but they will ask you your age, because which is right now the risk category 1B, which is 65 and over, or those who are 18 and between 18 and 65 who have at least one comorbid condition. And they accept people who are overweight, which is fine. Many people may qualify under that. Those who are diabetics, I asked some of the people register, and they said, well, I don't know, fit in any of the categories. And I said, aren't you taking some medicine? He said, no. Are you diabetic? He said, no, I'm not diabetic. Aren't you taking some medicine? I said, yeah, my doctor put me on metformin. So they don't want to accept they are diabetics, but they're taking metformin. So that is diabetes. So if you're taking even pre-diabetic metformin, you put as you're diabetic, and so you qualify. Hypertension will qualify. You have asthma or COPD or lung disease, you will qualify. Seizures, you will qualify. Stroke, you will qualify. So there is several categories can qualify. But if you are a young person who are 25 or a 18-year-old or you don't have anything, I think you should wait. I mean, I think we have to be responsible citizens. So this is for the older people. Let them get it first. So I will, whenever I know that there is an opening, I can. But the problem is, by the time I send it to somebody and they communicate to you all, it's all gone. So it's best thing is each one of you have this on your bookmark and check every day and see. And any of the kids, please have your family members' details with you, like your grandpa or grandma's details with you, and register it for them. You can do it because they may have struggled with it, but you can do it so quickly in your cell phone. So if you have all their date of birth and things on you, you can register for them. Anybody can register as long as you get the details, and take a picture of that and keep it and show up for the appointment. You may get a reminder, you may not, but just make sure when you make the appointment, you print it or just take it in your phone, keep it with you. They may send you an email confirmation. So with that, I will open up for questions. Thank you.
Thank you, Dr. Saab. That was a very informative, and we got a lot of our questions answered. Thank you so much for such a great presentation. And now we can open up for questions. One option is that you can type in your chat box and we can read it out for you, or you can raise your hand and we'll invite you one by one. Let's see if we can close this presentation here.
So Anilji, maybe you can moderate the questions and say who, and then go one by one, and you can take care of that.
Yes, we'll do that. Can you close your presentation so we can see the
I
whole
want to.
screen?
Okay.
Yeah.
So you stop share.
Yeah, stop share.
Okay.
You can see everybody.
Yes.
I think we have to open everybody's video so we can see everybody's hand.
Yes.
Sanjay ji, can you open everybody's video?
Oh, they have to open their own.
So there is a chat on Mr. Kapil. Mr. Kapil Mehta has put in there.
Yes.
How long the protection was observed in the clinical trial on the 172 volunteers who received 2 Modona doses. I don't know which slide he is referring to. Are you referring to the asymptomatic where I said about the protection from infectivity? Is that the slide you were saying?
Oh, sorry. Yeah, you mentioned about the protection that 172 volunteers, they were given 2 doses of the vaccine, Mrna doses. So I was wondering if they followed up for how long?
No, I mean, the both the Pfizer and Modona vaccine in the original clinical trial, both doses were given for the 75,000 people. All the 75,000 people had the 2 doses. The FDA requires 30 days after the completion of the second dose before they will even see the data. That's why they finished in December. Then we waited 30 days after the last recruited person was finished 30 days. And then, so we know now it's already another month has passed. So we know this is 75,000 people in both clinical trials received both doses. It's 2 months out. So, but the earlier people were the trial was started several months before. So we have now a large number of people have already 6 months or 7 months out.
Wonderful. That's very good.
We have a question from Devji. Please go ahead.
Okay, Devji.
Yeah, Dr. Raghav.
Yeah.
My question is that do we know how long this vaccination effect will last? Or do we have to, like flu, take every year?
Very good question. I think we don't know the answer to that, but they think, I mean, the current thinking is the vaccination will have antibodies longer than actual COVID infection. But we don't know whether it will last for 1 year, 2 years. So my gut feeling, or many people think it is going to be like a flu vaccine. So we're going to be like after flu vaccine, you will go and get this one. And more than likely, it will be just one shot in the subsequent years. Just get booster dose, a booster dose every year. I think that's how, but based on the data, if they say every 3 years, that would be great, but we don't know that yet. But I think it's going to be an annual thing.
Okay. Can I ask another question?
Yes, ma'am. Yes, ma'am.
You mentioned about, the vector in AstraZeneca.
Yeah.
What do you mean by vector? Is it a human vector, or what does it mean?
No. The vector means there is an intermediary, right? There's a live organism, a virus. So they got a virus, which is like a common cold virus kind of virus, actual virus, but it's not very pathogenic. It's like a very innocent or simple thing. So they keep that virus grown in the lab, ready to go. So they can easily inject the material into the virus. So the virus will carry like a mailman. So they have a virus in the lab, and they inject the nucleic acid material of the COVID or the protein into the virus. The virus will take it and get it into its nucleus, and it will get inside it. Now it's ready to be like a mailage, a postman. It will take it to whoever it is injected to. So it's just a carrier. So it's a vector.
So it could be any kind of virus, or is it?
No. They did research for 10 years for the ideal. So they had it ready to go. They had a little mailman sitting there. It's an innocent one. They tested it. So this is when no pandemic. It's on peacetime, right? So they had all the time in the world. So they put it through a lot of trials. So it had a safe vector waiting. So when this pandemic happened, they ready to go. They used it.
Now you said it is injected into the nucleus of that virus.
So that one actually enters your nucleus. So it is a potential to alter your DNA.
Yeah.
I mean, but the long term. So you have to wait for long term effects on that. Whereas this one, the 2 vaccines we have in the US, that is theoretically not possible because it doesn't even enter your nucleus. The only risk we had with this versus the AstraZeneca was that because it's only an mRNA protein, they thought this will be less effective because it's not even going into the nucleus, right? So it may create an antibody which is a weak antibody or something, but they hit a jackpot. They got a 95%, which was kind of a God's grace. It was an unexpected. They knew it would be safe, but they thought efficacy will be compromised because it's only a small mRNA protein. But they didn't. In fact, it came better than the AstraZeneca.
Now, you also mentioned about high dose, and high dose, low dose. What does that really mean?
In the AstraZeneca clinical trial, they had, I don't know the exact dosing amounts, but they used 2 arms in there. One was half of it was placebo. They didn't get anything. The other half, they divided into 2 groups, one little bit bigger group, one smaller group, who received a dose of the vaccine, like let's say 10 microgram or something. I don't know the exact. Then after 4 weeks, they will give 30 microgram. That's one arm. The other arm will get 30 and 30. I mean, I don't know the exact dosing.
Yeah,
I'm just telling you for hype. So the low dose, high dose arm had a 90% protection, whereas the high dose arm had only 62% effective. But which scientists were puzzled by why would that be?
Right.
So that kind of puts a little question mark on the whole thing, little bit.
Do you know anything about the COVID COVAX and the one from India?
They think it would be better than the flu vaccine. I don't know the full details of how they developed it and everything. They think but there is one India developed, one they are using the AstraZeneca in India in a different name. But they think about 60 to 90% efficacy, which is great for India if anything is going to be. In fact, Indian patients in India have handled it better than Western countries, as you all know. This was God-given grace because their mortality was much lower. And not only the surprise thing was the Indian government and Indian volunteer force and infrastructure was much, much more efficient than what it was in US.
Yes.
I mean, they tracked the people very well. They did a lot of very good jobs. So we need to, give kudos to our Indian colleagues. But I don't know the second vaccine. I didn't study that a little bit. I will next time if I'm talking, I would get some more information on your people in India. I'm sure your family and others would be wanting.
And I intercept here. Yesterday there was a report from Indian Vaccine in Lancet.
Okay.
And I know this is a attenuated vaccine.
Vaccine,
Which
yes.
came out of Bangalore.
Yeah.
Yeah. So I think that should be more effective, if you compare a single protein versus the whole virus.
That is what I was mentioning to you, that the viral vector vaccine, which is the one which is even AstraZeneca, would be hypothetically, the side effects are likely to be, 1 second, let me get to this battery. I have to just connect to card. Give me a minute.
Okay, so we have a lot of interesting questions coming out. We have a few more in waiting.
Yeah, please be patient. We're gonna get to your questions. We got many
Hmm?
questions on the chat box. And whenever if your question is answered, please you can take off the hand.
Yeah.
Yeah, that was what everybody expected, that the viral vector vaccines will be more effective, but more side effects because you are putting your live virus, and the so-called the neuroparalytic complications, the Guillain-Barré syndrome, and others were well described in those vaccines, and they expect them to be less with the mRNA vaccines because they're not full virus vaccines and they don't go into the DNA. So that was the big plus because the side effects will be less, but efficacy they thought will be less, like you rightly pointed out. But it didn't pan out in real life, or at least in this clinical trials. And one possibility is that when you inject a protein into another virus, and then that virus amplifies it, and that is what is injected. So you have like an intermediary, right? So you have a mailman in the middle, whereas these ones are straight into your muscle and that muscle is handling it. So you are cut the middleman out. So it's possible that that works better. And I think this is clean technology. If this pans out until the end of the year and everybody is happy, this will be the way to go in future.
Right.
Because this has never been done. This mRNA technology, even though was known, we never had a real life opportunity to use it. And this is the very first time. And so if this works out, this is going to be the way forward.
Yeah, all the
Thank you.
computational
So,
modeling.
Thank you very much.
Yeah, can we just move on to the, just give everybody a chance to ask a question. We have next one on chat box from Indra Singalji. When it is safe to take second dose after getting corona?
3 months. 3 months.
And we have one from, let me see, I think.
Same thing from me.
You mentioned.
I have. Can I talk now?
Yeah. Go ahead, ma'am.
Go ahead, please.
Thank you, Dr. Saab. I have one question. Recently in my family, after getting the first dose, they got the corona. So now the second dose is due this coming week. Is it safe to take the second dose, or they should postpone it for some time?
They should postpone it. This is a unfortunate situation. Yes, I mean, I think, but you don't need to take your first dose again, but you should wait 3 months and get the second dose.
Okay, thank you.
Because if you take your second dose now, your reaction may be very high and all that, and antibody response will be more and all that. So I think it's not safe. So you should wait. I know one physician's family who had COVID, and they didn't have the guidance clear at that time. So they were in a hurry to get it. So as soon as it was opened up, they went and got there because they are physicians and they could get it. And so the physician himself had 2 days of illness, exactly similar. He had COVID. And then 1 month later, he got the vaccine. And when he had his first dose itself, he almost similar to COVID disease, like his taste went away, his body pain, fatigue. So for 2 days, he didn't get admitted or anything, but it did the antibodies probably get so much amplified and produced. So you want to wait 3 months now, yes.
Because the family which I'm talking, they all are physicians, my brother and his wife. And
Yes.
3 children, they all got caught into it. So thank you. I will let them know.
That is what they're saying. This is a unique situation. And since they are family, they are physicians, they may, there may be, CDC may have some recommendations specific to the situation. But generally, I would say 3 months will be the safe time.
I will inform them, let them decide whatever they want. Thank you very much. Thank you.
Vijay, thank you. The next we have from Milind. You mentioned infectivity after the vaccine, which was clear. What about after getting COVID? when you still have antibodies for say 3 to 4 months?
Yeah, when you had COVID and you have recovered, when I say recovered, and some of you may know that there is two aspects to this. One is clinically you are clear of symptoms, that's recovery. The other is COVID test becoming negative. So most of us, most of the people who get COVID will become negative after 14 days. But there are children. I have one of my employees who had her kids got COVID and she's isolated at home. And the little kid who is only like 3 months old, she is now 5 weeks and she's still positive. So this is it's kind of not uncommon. Young kids, when they get COVID, they're running around, but they don't have any problem, but they are continuing to show the virus in them because the virus lives in them. So, but they are infectious. So, so the COVID recovery means by a test becoming negative. If you had COVID positive and then you became COVID negative, then for about 3-4 months, and I mean, as long as you don't get COVID again, you are not infectious.
Okay.
That we know. That we know. Yes.
Okay. Next one from Raghav. How does the vaccine tell your immune system how to fight and recognize COVID-19?
So our immune system generally, how it fights all the viruses is that it develops antibodies. Once you have, like for example, chickenpox, right? We get chickenpox disease itself, then the body realizes it's chickenpox, and then it gets IgG antibodies. And for life, you get IgG antibodies, you will not get chickenpox again. So same way, vaccines also tell our body to develop antibodies against a certain particular protein. Here they use the spike protein of the COVID virus, which produces antibodies, which is able to fight the actual COVID virus. So this is the leap of faith they used, and it is working. So now the IgG antibodies, whenever the COVID virus enters the body, it will immediately fight and neutralize. Like you have an antidote sitting in your body. So then as soon as the virus enters, it neutralizes, clears it up. So you are not going to get. So can you get, even if you get COVID, you may not even know because your antibodies would have cleared it, and you won't even, maybe 2 days you had it in your nasal passages and then it gone. You never knew about it. That's
Okay.
what happens.
Yeah.
Thank you.
Thank you. Okay, I don't think we have any more questions. So can I ask you a question on, can you please talk about, we are hearing a lot about this new variant, and
Yes, excellent question.
this vaccine is going to be effective, and are we going to see new variants coming out every year? Is this something we're going to deal like?
Yeah, I mean,
you can talk about it in
like
general.
Yes, a very good question, and it's on top of all of our minds as well. The viruses do mutate. That's not new. The virus it's a fundamental life existence in the universe, right? Life wants to continue. That is, wants to no matter what happens, the life wants to continue. That is the thing, right? So if a virus has to live, if you are fighting it with the vaccine, sorry,
I think it was breaking up. Can you please?
Oh, okay. So yeah, virus has to now develop some other mechanism for it to survive. So the virus modifies the RNA. This is an RNA virus. So it modifies itself, the nucleic acid composition slightly. Now it's a different virus or slightly variant. And the British variant was what everybody knew about. And now they have South African variant, and several variants are appearing. And what we know about them is they are little more infectious. So again, why is it more infectious? Because the old virus has already in the community, so it has some resistance. So the new variant is brand new, so it is spreading like a wildfire. But it is up to date, it is not considered more harmful than the other COVID or the original COVID variant. So it is still, the mortality is not considered very high in these people, but it spreads faster. That is, everybody thinks that it spreads faster, especially the British variant. So far, we think the antibodies developed by our vaccine can handle these variants. Now, new variants can come and the vaccine may become not, so they may have to also modify. Like, for example, the flu shot we are getting every year, they modify the composition of the flu shot based on the various mutations which happened in the previous year. So that's how the new flu vaccine is released for each year. Same way, the COVID vaccine also will be updated. They will put the updates, like we in the computer updates, they will also be updated. So hopefully we will keep up with the virus and prevent it. So to some extent, if 70% of the people have had the vaccine and many of us know how to survive, I think the halfway through this year, we will get past this and we will know how to live with this, and then it will become recede in our background. It may not go away, but it will become less of a thing and we will start to develop new ways to cope with the situation.
Thank you so much. Shekharji, you have a question?
Sure, Dr. Saab, I was diagnosed with the COVID early July, and just after a couple of days of symptoms, it went away. And then we were having this COVID testing at Arya Samaj in late November, and I just for the sake of just getting tested there, I tested, and I came positive again. It was like a 4.5 to 5 month gap.
And when was that? A month ago? Was it a month ago?
Means towards the end of November we had a
end of November. Okay, so end of November, now December, January, and so maybe whenever next in February you should get the vaccine. So that's unusual. I don't know, maybe you got exposed to somebody again. Did you become negative after your first infection?
No, I did not go.
You didn't get tested.
No,
you didn't get tested.
I don't know if I ever got. But I had no symptoms at all after the very first one. And actually, last month I did get my first dose.
You did get your first dose? Okay.
Yeah, I didn't have much of a reaction except that local muscle little pain first day.
So then you go ahead and get your second dose and done with it.
I am scheduled for this Tuesday.
I think you should get it because you don't have any symptoms. So forget about this. And then after a month or so, then you go and get tested. And then you may want to get tested for your antibodies.
I see.
Your PCP can order it.
Okay.
And Quest Lab does it.
For antibodies.
Igg antibodies. To see why you are having this. Yeah, if you have antibodies.
That would tell me that if I have produced antibodies in my system, is that what it would be?
Yeah, your body is now protected and you don't have to worry, I mean, there are people who have antibody positive and antigen positive for a short period until you are clearing it. But if you have antibody, that means you are well into your recovery and your protection.
And what should be the gap, sir, between my second dose and the test?
3 weeks. 3 weeks.
3 weeks.
3 weeks after. 3 weeks, 1 month.
And it would be safe to go to India?
It is safe to go to India after second dose.
Yes, sir. Yeah.
After second dose, 2 weeks after second dose.
2 weeks after second dose.
2 weeks after your second dose. 2 weeks. Yes. Yeah. And the other thing I wanted to mention is that if, let's say you have a family, you have your son, daughter, some of the people who have all been vaccinated, and all have received 2 doses, and it is 2 weeks have passed for everyone, then you could safely meet inside the house without the mask within that bubble or that group. If everybody in that bubble or group have been vaccinated, for at least 2 weeks have passed after the second dose, you can. But then you may have kids, little kids who are not vaccinated. That's the problem. Then they may have, they could become like a spreading, because somebody in this group can get it, or they can get it to the kids, and then the kids can spread it to somebody else who's not vaccinated. So that's a little bit of a risk. Maybe the kids can be separated, they can go upstairs or something.
Is there any other questions? We're just coming close to our presentation today.
Yeah, Anilji, I have a question.
Okay, who's that? I don't see you.
Bhushan Verma.
Bhushanji, okay, go ahead, please.
Okay, I sent you a text, but apparently it didn't get through. Thank you, Dr. Saab. I have a question about there's a kit being distributed in India, COVID kit, which has zinc, doxycycline, and ivermectin. Apparently, it's being distributed, and some of the people who have actually used it, they claim it is very effective. Any comment on that?
Well, there's a lot of this type of things, right, available, and the small things are available. Generally, they say zinc is good. Zinc is, it boosts your immunity. A lot of vitamins, you can take vitamin C, vitamin D. If you're already taking, they are all good. Hydration is good. Keep your throat and passages well hydrated. And then all our yoga techniques, which, improve your breathing things. Not like that it will prevent COVID or anything, but it certainly improves your capacity to handle it in case you get it. Because you have a good physical endurance, exercise, nice health. All of that will help you against, as opposed to you are not doing much and sitting in the couch, right? If you are physically active, well hydrated, and vitamins are on there is enough. And zinc is good, but I don't know the other components of what you are saying in India. But if it is something which boosts the immunity, maybe not hurt. But we don't have any data to support all of that. And a lot of information is available like that. So it's very hard to vet them out, right? So we need to use our judgment. But generally, improve your physical activity, nutritional health, and that should do it. And of course, social distancing and all that, you all know.
Thank you, sir. Appreciate it.
Thank you so much. I think with that...
Anilji, I have one more question.
Sure. Go ahead, please.
Yeah. Mentioned about the yoga. I understand that gargling with warm water, warm salty water, and also using jalneti for cleansing the nasal passageway, and also the does it kill the virus or also cleans it out?
I think keeping a good nasopharyngeal hygiene is good. I think warm water and even brushing your teeth a few times and goggling in the mouth as many times. All of that, in addition to washing your hands nicely, of course, and then you do that is good. The oral hygiene is good, and keeping all that is... Keeping a good nasopharyngeal hygiene is good. I think warm water and... I'm hearing myself.
Yeah. I muted, sir. I muted. Okay. Go ahead.
Okay. So yeah, those are good. No data on it, no clear data on it, but it is believed that that will help. Keeping some of the things... again, I don't have data to say when, I just, forceful expiration, sometimes like 20, 30 times, like that. You thought that you were in a contaminated environment, and you just come out to a fresh air and do it like 15, 20 times. No data, but I do that because I've been a physician, and I not long before COVID, we sometimes enter into patients' rooms and we don't know. And so I do that routinely after that. And just to cleanse, forcefully force those air out a few times. And so I believe that works, but who knows? But I don't have data on that. So not a scientific advice.
And one more question, sir, here. I mean, you did
The
mention
Kapalpati in the yoga, I will do that, right? Kapalpati, if you do that, that will help it.
Yes.
I think that Kapalpati is one of the very good things for our diaphragmatic and lungs things.
Yeah, it keeps the lungs very, very healthy. You know,
I think it should help in this situation, definitely.
Yes, sir. And you also mentioned about that India did take a good, good precautions, and they did do good. And I was really surprised, include India more so, and the third world countries, that they did not get that bad. You know, the death rate is so low. Is they already had a immunity to this kind of virus because of malaria and some other things that protected them? Otherwise, they can wipe off this quarter, half of the population. I mean, I was so afraid.
Yeah, you're right. I think two things might have played a role. One is they say the BCG vaccination. So even I had a BCG vaccine when I was a kid. I don't know, many of you might have. In India, they were giving BCG vaccine. I don't know whether they still do or not. And that improves some amount of immunity. So that might have had some role. Number two is they had a lot of this viral illnesses like dengue fever and chikungunya. So many diseases in different states had different ones. So all of this might have produced some kind of a non-specific antibodies in them. So they may be handling that better that way. That's one small thing. I don't know whether that I want to is like the exact incidence of mortality may not be reported correctly also. So we have there may be some under-reporting. And of course, death is death. I mean, we cannot hide death from anything. But illnesses, COVID infection may be going unnoticed. I'm sure, like you said, you didn't even have any symptoms. So in India, you may have completely unnoticed. You may not have been tested, right? So, so if you don't test and you don't have much thing, you're not going to count you, right, as a disease. But even the death in India, some of those will be, they won't make a big deal out of it. They will just, so some of even the death may be underreported. But even accounting for that, it is astonishingly low. But they did do a good job. I would say they did contact tracing much better than they did here. And I don't know how many of you are in touch with the Indian relatives. If you had COVID, they put a big sign outside your house. So you cannot come out. So you are quarantined. And others won't come in. They have a big sign from the health department, local, whoever they were doing, So they didn't do anything here. I mean, so many people who had trapped in India after the, initial months, and they came here, they were all surprised. They walked out of Houston International Airport. Nobody even asked anything. They just walked out. Whereas in India, they were giving soap and water every step of the way, and they were checking temperature before boarding the flight. But when they landed here, nothing here. And so they did take it much more seriously, the hand washing. I think it has helped India in a way. The hygiene has improved tremendously.
Yeah, but Dr. Saab, I have a question on this. I mean, and these days, if you don't know, if you know or not, in Delhi, there is a farmers in agitation, against the government for last 2.5 months. I mean, lakhs and lakhs of people are just jamming, sleeping, everything. And we have not heard really any of that.
We didn't.
It can't be virus free. This can't be virus free over there.
No, I think they have more. They have by now more community spread. They have more immunity by now. Actually, they may recover faster than us because of exactly that. They have a lot more herd immunity already.
Just one follow-up question on what Shekharji was saying and what you said that. So isn't there we can study? I mean, we are guessing is BCG or something else. We can study, West Africa has a very, very low death rate. Asian countries have very death rate. So can't we just study like scientifically and say, what is that? And adopt that practices in Europe and here, instead of spending so much money and time on vaccines and things which.
Yeah, I think the Western world would not, their pride probably won't accept that, but they should study. Yeah, they probably would say they are not reporting, and they'll just try to see. But I mean, no question about that. I mean, it's just ridiculously high. I mean, so a country like United States to have 1/4 of the mortality and cases of the world is just, very bad.
Well, thank you so much for such a wonderful presentation, and I wish we were open and we could invite you to Arya Samaj, and that would have been very nice.
Yeah.
And I think we will still do that whenever things open up. We like
Well, yeah, well, it'll be my it'll be my privilege to do that anytime. Yeah, we all our mandir, our Houston Hindu community, we are one, and I mean, anytime we all have to work together. Thank you so much, and share what you
invite Sanjay Jain ji to say a word of thanks, please.
Namaste, everybody. Dr. Vaduganathan, this has been the most compressed and very informative 1 hour on COVID. And we really thank you for that. And it was, you did it at Meenakshi Temple, and you said, okay, read this presentation. Right. And I said, no, we can do better. And you really helped us learn a lot more about it. My wife's a professor in biology, and she goes, let me listen to these slides. I mean, she was following everything you talked early on the scientific areas, and now we had doctors in audience too.
I'm sure
so
there's
I just
a lot
want
of
to thank you. Yeah, thank you very much for taking your Sunday afternoon and educating at least 38 of us, and which will of course spread. I also sent some information on the chat for everybody. If there are people have additional questions, I hope you wouldn't mind. Anilji will collect them at the email address of community@rsamajhouston.org. And lastly, this has been recorded on YouTube live on the Arya Samaj channel. So even for you, if somebody wants to visit, you can always tell them, hey, it's available here. And we really, really appreciate all the information you gave us. So thank you very much again.
So this is the community.
Go ahead.
Where is it? Where is the link for that YouTube recording?
It's youtube.com/RSMajHouston. We have our own channel, YouTube.com. Very easy. Just one word, RSMaj Houston.
And you go in, and this is archived as a presentation
this will show up as most recent. Yes.
Most recent. Okay.
Thank you very much again, Dr. Vaduganathan. Thank you.
One last question. Can we share your presentation with our congregation?
Yes, you can share it. You can put it. You can give the slides and everything. Yeah. Thank you.
Go ahead, please. Yeah.
Thank you so much. Okay.
Thank you. Thank you very much. Namaste.
Okay, thank you so much.
Thank you, everybody. Be safe for another few months, please. Okay. Thank you.